and welcome to our celebration of health, faith, and culture. My name is Kim Prendergast, and I have the pleasure of serving as the Executive Director of the MetroWest Free Medical Program. And I've been with the program for the last 8 years, and it's such a wonderful opportunity for all of us to be here together this evening to celebrate the work that we do in this community, to celebrate the partnership between the MetroWest Free Medical Program, all of our volunteers, Congregation Bethel, and First Parish. Just wanted to walk through a day in the life of the MetroWest Free Medical Program. Here at our Sudbury site, at about 4:30, our setup volunteers come, and they transform our space from the beautiful sanctuary of Bethel into a medical clinic. For the past 11 years, patients see Karen Siegel as one of the first faces when they walk in the door and are greeted here at our registration table. Karen, as a nurse and an interpreter speaking Spanish and Portuguese, greet the patients and assure that they understand why the patient has come tonight, figure out which clinician the patient is looking to see that evening, and making sure if they have any acute needs that we need to be aware of. Our front desk volunteers then get busy right away finding those medical charts, putting in the new papers that are needed, creating charts for new patients, and being certain that the physicians and nurses have all of the paperwork that they need. Next, the patient's going to be seen by a triage nurse. Here, they test their vital signs, their blood pressure, their pulse, check heights and weights, reconcile their medications, and determine what the chief complaint is, why the patient has really come to us to see the physician that night. And the education starts here as well. Nurses talk with patients about ways to manage their health if they have high blood pressure, high cholesterol, or other issues. But while they're waiting, there are other services that we offer for them. Those include the ability to test their blood sugar and their cholesterol. And over the years, we've found many cases of chronic disease for patients who were unaware of that condition. We're also talking with patients about really why they're here, and we're able to have them see the social worker, as well as do an insurance application. At the MetroWest Free Medical Program, our goal is to not only provide great quality care for the patient this evening while they're with us, but also to serve as an entry point into the healthcare system. Now it's time for the patient to see the clinician. Here in our exam rooms, patients are seen for a variety of acute and chronic diseases, from hypertension to asthma to diabetes, orthopedic issues, and many more. Every Tuesday evening, we offer general medicine and psychiatry services, as well as rotating specialists depending on when the volunteers are available. Each month, we have a diabetes clinic, an asthma and allergy clinic, physical therapy, dermatology, and we even have cardiologists and pediatricians to see patients as well. A few years ago, we recognized that MetroWest Free Medical Program patients often weren't understanding how to take their medications or even how to get their prescriptions filled or refilled. We've partnered with the Mass College of Pharmacy and Health Sciences to bring professors and students to offer pharmacy education. Before the patient leaves, they visit our discharge desk. Here, if they've received a lab or an x-ray form, we're making sure that those are ready for them to be seen at the hospital in Framingham, that the patients know where to go, and that they understand all of their follow-up needs. None of this could be possible without the expertise and dedication and services of our medical interpreters. About 2/3 of the patients seen by the MetroWest Free Medical Program don't speak English, or at least don't speak English well enough to have their visit conducted in English. So each week, Spanish and Portuguese interpreters join our team to be certain that they truly understand their health and all of the needs that they have once they leave these doors. And at the end of the night, at 9 or 9:30, our breakdown crew comes back to help us put all of the supplies away. Our second site is at First Parish in Framingham. On Monday evenings, our team gathers to provide a vision clinic for patients who need optometry and ophthalmology services. And on Thursdays, they gather to provide women's health. Over the last 11 years, the MetroWest Free Medical Program has provided care to nearly 15,000 patient visits with the help of about 500 volunteers working in various capacities to make our program the community healthcare space that it has become.